Chapter 30. Diseases of the Heart. The human heart is a marvelous organ. Its function is to move the living stream of blood through all parts of the body, never stopping even for a moment in its endless activity. Although the heart is one single organ, it actually consists of two pumps, right and left. The right side of the heart, with its two chambers, receives blood from all parts of the body and propels it to the lungs. There the blood drops its load of carbon dioxide and receives a fresh supply of oxygen, then passes to the left side of the heart, with its two chambers also, and from there it is pumped to all parts of the body. Each side of the heart operates independently of the other, but they act together in keeping the blood circulating normally. The walls of the heart consist of powerful muscle fibers that have the power to contract or beat rhythmically. This constant rhythmic beating keeps the circulation going. Your heart does an enormous amount of work. It beats over 100,000 times a day, continually pumping the blood through more than 60,000 miles of tiny blood vessels. These tiny capillaries are only a tenth of an inch long, but if they could be placed end to end, they would stretch 2.5 times around the Earth at the equator. To maintain the right pressure, all these vessels must be filled with the right amount of blood, otherwise the tissues of the body would waste away and die. How the heart beats. The motions of the heart are maintained by a specially designed structure known as the sinoatrial node or SA node. This little structure is capable of initiating a regular rhythm, and transmitting these electrical impulses to all the muscle fibers of the heart wall. This is how the constant rhythmic contractions are maintained. This SA node or pacemaker is located near the top of the heart. It really operates like small radio station, flashing out its signals in 234 diseases of the heart. Regular electric waves. These are the P waves seen on the electrocardiogram or tracing of the heart. These P waves make the atria or auricles, left and right upper chambers, contract to fill the ventricles, the two lower chambers. Lower down near the main valves of the heart, another small structure, the atrioventricular or AV node, picks up these radio signals and transmits them through the special conduction fibers or filaments to all the muscle cells of the powerful ventricles or pumping chambers of the heart. These electrical impulses are the QRS waves seen on the electrocardiogram. Almost instantly after the QRS wave the ventricular walls contract, emptying the pumping chambers into the aorta and out to all the arteries. This is the pulse you can feel at your wrist. Then for a split second the heart relaxes and fills with blood. It is now ready for the next contraction or beat. This whole amazing process is an engineering feat without any equal. Because of the simultaneous electric flash, all the heart muscle cells contract as one unit, even though they are each stimulated individually by these electrical impulses coming from above. The coronary arteries. Naturally, to maintain all this activity, the heart must feed itself. It must also be constantly supplied with oxygen. The heart's own blood supply is maintained by two very important vessels known as the coronary arteries. Centuries ago early students of anatomy discovered these vessels winding their way around the heart and thought they resembled a crown, hence the name coronary. They are among the most important vessels in the body. If one of these should fail, the heart might stop and that would be the end. As the blood leaves the left side of the heart, it passes through a large artery known as the aorta. This great vessel, nearly an inch in diameter, passes upward from the heart, then curves over to the left, and passes down behind the heart into the abdomen. As mentioned above, the first branches of the aorta are the left and right coronary arteries. These supply the heart itself with blood. Other large branches supply the head, neck, upper extremities, and all the organs of the chest and abdomen. Down near the pelvis the aorta divides 236 diseases of the heart into two major vessels that supply the pelvic organs and the lower extremities. This great network of vessels is known as the arterial system of the body. Out in the tissues the smaller arteries divide into endless tiny hair-sized vessels called arterioles, and these in turn divide into still smaller vessels called capillaries. It is through these innumerable tiny capillaries that the exchange of oxygen and food substances takes place. The waste products and carbon dioxide from the tissues are then picked up by the bloodstream and brought back through the smaller veins. These, like the tributaries of a river, join together forming larger vessels until eventually the blood reaches the two largest veins, the superior and inferior vena cava, and through them returns to the right side of the heart. Blood coming toward the heart from distant areas of the body is dark red in color, as you will see whenever you cut yourself. From the right side of the heart this darker blood is pumped to the lungs. There it gives up its surplus amount of carbon dioxide and takes on a fresh supply of oxygen. This extra oxygen immediately changes the color of blood to a brighter red. The freshly oxygenated blood then passes through the large pulmonary veins to the left atrium, auricle, of the heart. As soon as the mitral valve opens, the bright red blood flows down into the left ventricle and is immediately pumped by way of the aorta to the entire body. The left ventricle contracts or beats about 70 times each minute, not for an hour, a day, or a year, but for an entire lifetime. How the heart grows. The heart is such a remarkable organ that perhaps a few words about how it develops and grows are in order. Within the first 2 weeks after conception, a small tube begins to form in the tiny embryo or unborn baby. Believe it or not, this is the forerunner of all the blood vessels in the body. A few embryonic blood cells also begin to float around within this tiny vessel. This is the beginning of the bloodstream. From these early developments the entire circulatory system of the body will eventually form. As the little tube expands and grows, it begins to twist in a certain way, forming at first just one single chamber. This is the beginning of the heart. Within this enlarging area is septum or circulation before birth 237. Dividing wall begins to grow, forming not one but 4 chambers. The 2 upper chambers are the left and right atria, or auricles, the 2 lower, the left and right ventricles. Normally there is no connection between the right and left sides of the heart after birth. But special doors or valves open between the atrium and ventricle on each side of the heart, so that the blood will flow in only one direction. This whole mechanism is surprisingly simple, considering the enormous amount of work this embryonic heart must do. Any failure in the development of the septum or valves may lead to some form of congenital heart disease. Circulation before birth. During fetal life there is no connection between the baby's bloodstream and that of his mother. All the blood flowing through the baby's heart is always his own, never his mother's. Her blood circulation is entirely separate, as is shown on page 151. However, the baby's bloodstream flows close to the mother's, being divided by a very fine living membrane so that he can pick up food materials and oxygen necessary for his own growth, and at the same time get rid of the materials he no longer needs. As the tiny unborn baby grows, so does his heart. The most critical time of growth is during the first 3 months of pregnancy. If at that time his mother should come down with some virus infection, such as German measles, the baby's heart may be deformed by some type of congenital heart disease. Doctors recognize 4 major types of heart disease: congenital heart disease, rheumatic heart disease, hypertensive heart disease, and coronary artery disease. In addition, there are several minor types to which brief references are made in other parts of this book. We will briefly outline several of the more common types of congenital heart disease here. Congenital heart disease. Some babies are unfortunate enough to be born with a damaged heart. This is known as congenital heart disease. The defect apparently arises from some infection or injury to the baby's heart during the first 3 months after conception. Congenital heart. 238 diseases of the heart. Disease is less common than other forms of heart disease, but when it occurs, it can cause plenty of trouble to all concerned. There are many varieties of the disease, no 2 cases being exactly alike. Atrial septal defect is an abnormal opening or shunt between the 2 upper chambers of the heart, the right and left atria or auricles. Instead of flowing in the normal direction, part of the blood from the left atrium flows across into the right atrium, and is then recirculated through the lungs without having passed out into the tissues to nourish the body. This forces the right side of the heart to work doubly hard for no good reason. This abnormal opening or defect raises the blood pressure on the right side of the heart. The child often suffers from frequent chest colds and may fail to grow as rapidly as he should. Eventually, because of extra resistance build. Defects in the heart 239. Up in the vessels supplying the lungs, the blood flow may reverse itself, passing from the right to the left side. When this occurs, the patient may turn blue, a condition known as cyanosis. Surgery on the heart is the only satisfactory answer to this problem. Under suitable anesthesia, the patient is cooled to a low body temperature. The chest is then opened and the defect repaired. Most patients make a satisfactory recovery following this operation, provided the abnormal opening is not too large and does not involve the mitral valve. Once the patient turns blue, the risk of operation is greater, but even at this stage something can usually be done to help. Ventricular septal defect means an abnormal opening or shunt. 240 diseases of the heart. Between the right and left ventricles or pumping chambers of the heart. Because of the higher pressure on the left, some of the bright red blood coming from the lungs is forced through the defect in the septum or dividing wall, where it floods the right side of the heart. This excess blood is recirculated through the lungs, another described above. The pressure in the right side of the heart is increased, and there is a loud murmur heard over the breastbone or sternum. Not only is there danger from overloading the lungs, but in this type of defect the patient may possibly develop a very serious condition known as subacute bacterial endocarditis, SBE, or some other serious inflammation involving the heart muscles. Whenever possible, the defect should be closed by a surgical operation on the heart, using the ear-lung machine. In this operation, the surgeon usually stops the heart and allows the machine to pump the blood while the defect is being repaired. Patent ductus arteriosus means that a certain vessel called the ductus, which normally closes at birth, has remained open, allowing blood to pass from the aorta to the pulmonary artery. This produces an effect similar to the atrial and ventricular septal defects described above. The only difference is that the abnormal opening occurs between the great vessels just outside the heart. This produces a continuous machinery murmur which is heard mainly in the upper part of the chest on the left. Eventually, the extra strain upon the circulation may cause the heart to fail. Worse still, the abnormal opening may become the focus of infection for subacute bacterial endocarditis. Eventually, the vessels of the lungs may become constrict and refuse to carry the excess blood. This raises the pressure in the pulmonary artery, so that eventually the shunt may flow in the reverse direction. The patient may then turn blue or cyanotic, especially when he exerts himself. He may complain of shortness of breath and pains over the heart. However, a few people do manage to live for many years with this condition, provided the opening is not too large. Surgery is the best treatment for this condition. The abnormal channel should be closed, preferably sometime between the 4th and 10th year's life. Meanwhile, the child should be taking penicillin or some other suitable antibiotic to prevent serious complications. Coarctation of the aorta means a localized constriction or NAR. Rowing of the aorta near the point where the vessel crosses behind. Septal defects 241. The pulmonary artery. This is the spot where the ductus arteriosus or cross-channel between the aorta and pulmonary artery existed before birth. As we have just noted, in a few children this vessel fails to close, producing a patent ductus arteriosus. This narrowing of the aorta means that the lower part of the body has a lower blood pressure than that found in the head and neck. Blood flow is also much slower in the leg than in the arm, unless other vessels open up to supply the lower extremities with blood. The patient may complain of numbness and weakness in the legs, and also severe headaches due to the very high pressure of the bloodstream going to the head. There is a loud murmur in the chest, which may also be heard all over the abdomen. X-ray films of the ribs show notching along the edges of the ribs because of the increased size and twisting of the intercostal arteries. The condition is serious and should be adequately treated early in life, otherwise 3 out of 4 patients with coarctation will die before they reach 40 years of age. The best treatment is to remove the narrowed portion of the aorta by surgery, bringing the two ends together and perhaps using a small graft to repair the defect. Such operations can be done only by qualified teams of surgeons and cardiologists working together at some large medical center. Tetralogy of Phalate is a serious malformation in which there is a defect in the ventricular septum. This allows the aorta to receive blood from both the right and left ventricles. In addition, there is narrowing or stenosis of the pulmonary valve and hypertrophy or enlargement of the right ventricle. The large defect in the septum allows the darker and lighter blood to intermingle, so that the patient is bluish or cyanotic much of the time. A young child with this deformity may have to squat down to get his breath after attempting to play like normal children. Because of the narrowing of the pulmonary artery, much of the blood passes from right to left, thus depriving the child of a normal supply of oxygen to meet his needs. There may be clubbing of the fingers and toes, and the child's growth may be retarded. Most of these children die in their early teens unless given the benefit of good surgery. The red blood count tends to rise, the red cell count often going above 10 million instead of the usual 5 million. Rheumatic heart disease 243. The greatly thickened blood also slows down circulation. In severe cases, the child may have spells of unconsciousness brought on by lack of oxygen in the brain. A rough, harsh murmur is usually heard all over the chest. The standard treatment for this condition has been the construction of an artificial channel or ductus between the pulmonary artery and the aorta, or between the pulmonary artery and one of the subclavian arteries. This forms an artificial ductus arteriosus condition similar to that described above. But even this defect will help the child. More recently, heart surgeons have been using the heart-lung machine in attempting to close the larger opening in the ventricular septum between the right and left sides of the heart. Some suitable plastic material is used for this purpose. There is still considerable risk in this operation, but some techniques such as this will eventually become the treatment of choice. Pulmonic stenosis means a narrowing of the outflow tract from the right ventricle, either directly at the valve or in the muscle tissue just below. Valvular stenosis is often associated with atrial septal defect, described on page 238. The child with pulmonary stenosis often suffers from shortness of breath when attempting to play with other children. A harsh murmur is heard all over the chest. X-rays of the heart usually show an abnormally large pulmonary artery. If the narrowing is very marked, the right side of the heart may fail, the liver becomes enlarged and tender, and legs and ankles swell. Pulmonary valvular stenosis can now be corrected by means of a surgical operation, using either hypothermia or the heart-lung machine. Rheumatic heart disease. Rheumatic fever has already been discussed on page 228. In all cases, the heart is involved to some extent, and in a certain number of these children the heart may be permanently damaged. Much depends on the treatment given during the earlier stages of the disease. The first attack of rheumatic fever usually comes on at 7 or 8 years of age, most often following a severe infection of the throat with beta-hemolytic streptococcus germs. Although rheumatic fever affects the heart as a whole, the most serious permanent damage occurs in the valves, those important doorways leading from one chamber to another. Rheumatic heart. 244 diseases of the heart. Disease is a crippling condition affecting far too many children and young people. Out of every 100 children with some form of heart disease, only 2 will have congenital heart disease, while 98 will have rheumatic heart disease. Most frequently the mitral valve becomes damaged or thickened. The chorda tendineae or muscle fibers supporting this valve tend to become shortened and fused together, so that the valve can neither open nor close properly. Because of the narrowing or stenosis, the blood has difficulty in passing from the left atrium to the left ventricle. This causes a rumbling diastolic murmur. If the valve cannot close properly, some of the blood is forced back into the left atrium each time the ventricle contracts. This further impedes circulation. The aortic valve has 3 cusps, or doors, that open and close simultaneously with the motions of the heart. These may also be tools for examining the heart. 245. Involved. The edges of the cusps may stick together and thus prevent the valve from opening properly. This causes the serious condition known as aortic stenosis, a type of obstruction that raises the blood pressure inside the ventricle and puts a heavy strain on the heart muscle. In some cases the valve cusps may also fail to close properly, resulting in another serious condition known as aortic insufficiency. In this condition there is a leaking back of blood from the aorta during the split second when the heart is at rest. This leakage of blood lowers the pressure in the aorta, causing dizziness and weakness, especially if the diastolic or lower blood pressure drops down to 30 or 40. Of the two valvular conditions, the aortic stenosis and insufficiency is the more serious. In some cases both mitral and aortic valves are involved. Heart surgeons are now able to free the mitral valve cusps and repair the damage so that the left ventricle can receive its normal supply of blood. This is best done using the heart-lung machine. A more difficult situation exists when both mitral and aortic valves are involved together. The narrowing or stenosis of the aortic valve may be corrected, but the risk of surgery is higher. Today both mitral and aortic valves can sometimes be removed and artificial valves used in their places. This means that the life expectancy of patients with rheumatic heart disease is much better than it was even 20 years ago when many were doomed to lifelong invalidism. Tools for examining the heart. In many of the larger medical centers today, highly trained teams of specialists are now developing newer and more wonderful ways of studying damaged hearts. This is particularly important before surgery is attempted. In one useful method of study known as heart catheterization, a thin flexible tube is passed through an artery or vein in the arm or thigh and into the chambers of the heart. Through this flexible tube samples of blood are drawn and various pressures are measured. Certain dyes can then be injected through the catheter tube on outline the chambers of the heart, and also to see if there are any abnormal shunts or narrowed valve openings present. This is particularly useful in preparing the patient for certain types of heart surgery, such as enclosing a hole in the septum or replacing a scarred valve with a new artificial valve. 246 Diseases of the heart. Angiocardiography, or arteriography, is the method by which certain blood vessels with dye materials are outlined while under X-ray. Remarkably clear pictures can now be obtained, enabling the cardiologist and cardiac surgeon to better understand the problem in hand. Orthocardiography is another method of outlining the size and shape of the heart by means of a special X-ray. The patient merely drinks some of the barium mixture and X-ray films are taken immediately after. These pictures show the course of the esophagus and thus show whether the chambers of the heart are enlarged or not. Vectorcardiogram is a newer method of studying the electrical activity of the heart by means of a machine similar to the electrocardiograph. This sometimes gives a more accurate picture of the electric current as it passes over the surface of the heart. To a doctor trained in cardiophysiology, it reveals much valuable information which may not always be clear on the electrocardiogram. However, vectorcardiography is really only a more highly advanced research tool. In most cases the electrocardiogram is all that is needed for a full evaluation of the electric activity of the heart. Phonocardiograph is another special instrument which measures the actual sounds of the heart as heard through the stethoscope. It is useful in determining the location, quality, and importance of various heart murmurs. Like the vectorcardiograph, this is a research instrument of real value in dealing with certain obscure heart conditions. Hypertension. High blood pressure is a very common condition seen in modern life. In most cases the true cause is not known. Certain hormone changes in the kidneys may be partially responsible. Nervous tension also plays an important part, for reasons that are not too clear at present. A certain tumor, known as a pheochromocytoma, may also raise the blood pressure, but this is very rare. In about 10% of cases infections of the kidneys are also sometimes responsible. Tachycardia of pregnancy is another cause, and so is coarctation of the aorta. All these conditions are discussed elsewhere in this book. but in the great majority of cases we are still at a loss to explain why the blood pressure is elevated. We certainly know something. High blood pressure 247. About what is taking place, for we can measure the rising pressure. But why does it start to rise? This is still a mystery. Doctors call this type essential hypertension, a simple admission that we just do not know. Usually the process is slow, but in some cases it comes on much more rapidly, developing the very serious form known as malignant hypertension. Not only is the heart affected, but changes may also occur in the eyes. Blind spots may interfere with the vision because of retinal hemorrhages, especially in the later stages. The situation is serious but not hopeless. Most hypertensive patients have a family background of strokes, heart disease, and kidney ailments. Young people from such families often begin to develop high blood pressure during their early 20s, probably because of some hereditary factor. Such individuals seem to be abnormally affected by the ordinary stress and strain of living. Nervous stimulation may cause changes in their arterioles. During the early stages, the hypertension or high blood pressure may be more or less transitory, usually passing off after the emergency is over. Later the changes tend to become more permanent, perhaps because of some changes involving the kidneys. Nervous factors also play a large part. For instance, if the person with high blood pressure merely plunges his hand into ice-cold water, his pressure will rise far above the level of someone else who does not have hypertension. This may be due to irritability of the nervous system. Any kind of excitement will cause the hypertensive patient's heart to pound more vigorously, and this pounding or palpitation may last for a longer than normal time. This would seem to indicate that essential hypertension is not due to any single cause but rather to several complex factors which we do not yet fully understand. People with untreated hypertension do not live as long as those whose blood pressure is normal. However, when the patient is given the proper treatment, he can usually expect to live a more or less normal life, unless the pressure is very high. Normal blood pressure is 120/70, but may go up to 140/90 and still be normal. Anything above this tends toward hypertension, especially if the pressure goes up to 180/120. The upper figure is known as the systolic pressure, but it is the lower or diastolic pressure that gives doctors the greatest concern. The diastolic pressure should be maintained below 90, if at all possible. F17. 248 Diseases of the heart. Patients with high blood pressure often complain of headaches, the pain being located mainly in the back part of the head and neck. Tiredness and fatigue, often without any obvious cause, may be another indication of hypertension. Such persons may also complain of dizziness, especially at the moment of sitting up or lying down. Palpitation of the heart is also seen in patients with hypertension. Organs most likely to be affected are the heart, the brain, and the kidneys. Women with high blood pressure are more likely to develop toxemia during pregnancy. Treatment: patients with high blood pressure should always try to follow a well-balanced program of exercise and rest. Walking is an excellent form of exercise. It builds strong muscles and helps to relieve the tensions of life. This also aids in the circulation of the blood. The excessive use of tea and coffee should be avoided, because both contain caffeine, a highly stimulating drug that always whips up the nervous system into further activity. Patients with high low blood pressure 249. Pressure should not smoke, for tobacco constricts the smaller vessels, raises the blood pressure, and increases the workload of the heart. It is better to stop smoking permanently. Medicines for high blood pressure include Rauwolfia products, such as reserpine, 0.25 mg once or twice daily, and chlorotiazide or diuryl, 500 mg. Or Essitrix, 50 mg, 1 tablet once or twice daily. Avoid the excessive use of salt, for this increases the pressure as well as the work of the heart. Most important of all, one must try to develop a contented mind. A quiet, restful attitude will do much to relieve the tension of everyday living. Train yourself to shut out all the discordant sounds of the world around you. Try to forget the worries that so often lead to hypertension. Remember that the cultivation of the mind and soul is always the best way to find healing and peace. These are the secrets of living without fear. Low blood pressure. Low blood pressure or hypotension is far less common than hypertension or high blood pressure. Sometimes the pressure falls rapidly because of hemorrhage or loss of blood. Low blood pressure may also come on gradually because of slow bleeding in the gastrointestinal tract, or through the kidneys or bladder. Any lack of normal protein in the diet may also lower the pressure because of malnutrition or actual starvation, or because of some endocrine disturbance, such as hypothyroidism, discussed on page 543. In rare cases, an islet cell tumor may form in the pancreas, producing an excessive amount of insulin and lowering the blood sugar, as shown on page 553. Such patients always tend to feel tired and worn out. Emotional problems are a far more frequent cause of low blood pressure. For instance, some people will fall into a dead faint on hearing bad news. This shock-like state is probably brought on by temporary disturbance in the vasomotor system, causing the patient to collapse. To a lesser degree, prolonged disappointment and frustration may also result in a subnormal blood pressure. Relieving the chronic stress, if at all possible, and at the same time developing a sensible attitude of mind, may be all that is needed to bring the blood pressure back to normal. One should also add a little more protein to diet, and be sure to take sufficient rest and exercise. 250 diseases of the heart. Heart attack. Like every other organ, the heart is subject to disease. The most common form is coronary artery disease, or arteriosclerotic heart disease. When one of the coronary arteries becomes blocked by a blood clot, the patient suffers from coronary thrombosis. This is a true heart attack. Many people think they are having a heart attack when they feel their hearts beating irregularly. The feeling may be uncomfortable, but this is not a true heart attack. Nor is the pain of angina a real heart attack, although it may lead to one later. A true heart attack occurs when one of the coronary arteries feeding a portion of the heart muscle has become occluded or blocked. As a result, the muscle cells become sick, unless blood can be shunted from surrounding vessels meet the need of this damaged tissue, those cells will die. This is known as coronary thrombosis, a most serious condition indeed. Almost always there is severe crushing pain in the chest. Coronary disease 251. Coronary artery disease is the most common of all forms of heart disease today. More people die from coronary thrombosis than from all other forms of illness put together, including infections, accidents and cancer. Many of these victims are men who are cut down by a severe heart attack during their most productive years. To understand this problem, we must briefly review the anatomy and function of the heart. The coronary vessels supply the heart muscle itself with blood. These two main vessels, the right and left coronary arteries, arise from the very first portion of the aorta. They encircle the heart, supplying every muscle fiber with blood. During that brief moment when the heart is contracting, the blood rushes through the aortic valve into the aorta and onto all parts of the body. During this split second when the heart is contracting, the openings to the coronary arteries are closed by the aortic valve cusps. When the aortic valve closes, the openings to the coronary arteries are uncovered. This allows blood to flow through these all-important vessels of the coronary system. It is during this split second when the heart walls are relaxing that the heart feeds itself. Blood flows through the coronary system more easily when the heart beats with a steady rhythm. The heart is far less efficient when the rhythm is irregular, as in atrial fibrillation. Like arteries in other parts of the body, the coronary vessels can undergo certain changes, known as atherosclerosis. In this condition, the elastic walls of these arteries become damaged in some way. The cells are then replaced by a soft, pasty material that often interferes with the normal flow of blood. Eventually this mushy substance becomes filled or replaced with lime or calcium. The vessel walls become hard and can no longer expand or contract. This further stage is known as arteriosclerosis. The inner surface of one of these narrowed vessels becomes roughened and may then begin to trap some of the tiny microscopic platelets in the bloodstream. As these platelets begin to stick to the roughened surface, a clot forms, and before long that blood vessel is completely blocked. As long as the blood can still get through the vessel, there may not be too much disability. But the individual may find he can no longer do quite so much work as he once could. As the blood supply to that part of the heart is reduced, he may begin to suffer from sharp pains in the chest. It may be transitory as in angina, or prolonged and severe as in coronary thrombosis. 252 Diseases of the heart. This type of heart disease is 4 times more common in males than in females. The disease is more prevalent in certain families, and seems to occur most commonly in the 40s and 50s. In some cases it begins in the 30s or even late 20s. The true cause of coronary artery disease is still somewhat mysterious. However, people who live on a high-fat diet, supplemented with highly refined foods, seem far more likely to develop coronary artery disease. Those who choose a plain diet, low in fat, seem less likely to develop this disease. Cholesterol is also an important factor. Many victims of heart disease have a high cholesterol level in the blood. A plain, sensible, well-balanced diet free from animals' fats will help one to avoid many of these serious complications. Certain factors predispose one toward coronary artery disease. Among these are diabetes mellitus, hypothyroidism, obesity, and old age. People who smoke heavily are far more likely to develop coronary artery disease. Their life expectancy may be lowered from 5 to 10 years or more. Patients with heart disease should learn to live on a plain, sensible diet, and avoid the use of tobacco, if they really want to stay out of trouble. Angina pectoris is a sharp, stabbing, or crushing pain felt mainly in the chest. Sometimes the pain is also felt in other areas, such as the left shoulder, arm, or jaw. These pains are brought on either by exercise or by emotional stress. They can be quickly relieved by rest, or by dissolving a nitroglycerin tablet under the tongue. These are the pains of coronary insufficiency. The coronary arteries are no longer able to supply enough blood to the heart muscle for the amount of work to be done. As long as the individual does not exceed the normal limits of exercise, he remains free of pain. But once beyond this point, nature lets him know that he must slow down and rest. These sharp pains are a valuable alarm mechanism, warning the patient not to exceed his limits, or he will suffer more severe heart damage. Sometimes the angina comes on when climbing stairs, walking against the wind, or passing through some period of excitement. Angina pains may also be felt after taking a heavy meal. They are often associated with gallbladder disease. These pains are described as squeezing or crushing, and may last from 20 to 60 seconds. Any pain lasting much longer than this may be due to more serious condition, coronary thrombosis. Coronary thrombosis 253. In some cases the electrocardiogram may show certain changes, particularly during the time of pain. This is more likely if the heart has become enlarged owing to an elevation of blood pressure. Treatment: do not try to do too much. Learn to live with this condition. If you feel a sharp pain in the chest after moderate exercise, nature is probably telling you not to exceed your limit of tolerance. Nitroglycerin is the most useful medicine we have for controlling angina pectoris. This little tablet is dissolved under the tongue and quickly relieves the pain. Angina patients should always carry a few nitroglycerin tablets with them. There is no danger in using nitroglycerin, and in many cases it may be truly life-saving. Patients with angina should not smoke. They should also abstain from coffee and alcohol. In more severe cases, blood-thinning medicines, such as Coumadin, should be used. Some mild sedative should be given 3 or 4 times daily to reduce nervous tension and relieve the heart of unnecessary strain. The use of oxygen, particularly during the hours of sleep, may help to ward off further attacks. Longer-acting medicines, similar to nitroglycerin, such as peritrate, will help to dilate the coronary vessels and increase the flow of blood to the heart muscle itself. Coronary thrombosis. Acute coronary thrombosis, or coronary occlusion, is one of the most serious conditions affecting the heart. In most cases there is very severe pain and often a state of shock. Another term for this is myocardial infarction. Coronary thrombosis is far more serious than angina, described above, where the pain is only temporary and is due to an insufficiency amount of blood supplying some portion of the heart muscle. In a true heart attack due to coronary occlusion, the blood supply is completely cut off to some area of the heart wall. In some cases a large clot of blood may form over part of the inner surface of the heart. Fragments may then break off and be carried by the bloodstream to the lungs, the brain, the kidneys, and other organs. The blood clot itself is known as a thrombus. A fragment broken off is called an embolus. If the trouble occurs on the outer wall of the heart, an aneurysm or bulging may occur, interfering with the normal action of the heart. The greatest danger from serious complications following a heart attack occurs during the first 2 weeks. Symptoms: the patient usually complains of severe crushing. 254 diseases of the heart. Pains in the chest. There is a feeling of heavy pressure as if the patient is being held in a vice. This pain is not relieved by nitroglycerin. It may continue for hours or days as crushing pain, and there may be extreme shortness of breath and possibly nausea, vomiting, and hiccups. This may then be followed by extreme weakness and fear of impending death. The skin is pale, cold, and moist, and the lips bluish in color. The pulse is usually weak and slow, and may be irregular if there is change of rhythm within the heart. Most patients with heart attack manage to survive at least 2 or 3 days, and then slowly begin to improve. A few may not pull through even the first severe bout of pain. Unfortunately, second and third attacks are common when the coronary arteries are narrowed by disease. Diagnosis: a correct diagnosis is most important. Other chest conditions, such as pleurisy and inflammation of the chest wall, also cause severe pain. Naturally, the treatment for these is far different. The electrocardiogram is valuable in all cases and should be taken every day during the period of severe pain. In a few patients there may be little change until after several days have passed. Most patients complain of fever, and there is an increased white blood count, as well as an elevated sedimentation rate and transaminase test. Changes in these tests may occur in other serious conditions, such as pericarditis, embolism to the lung, dissecting aneurysm of the aorta, and even peptic ulcer and acute conditions of the pancreas and gallbladder. Hence the importance of correct diagnosis is anything involving the heart and great vessels. Treatment: pain and shock must be relieved at once, either with morphine or some other powerful pain-killing medicine. The patient should be given oxygen continuously at first. Intravenous fluids, such as 5% glucose or dextrose, are useful when the blood pressure is low and the skin cold and clammy. To combat shock and keep the blood in circulation, a plastic catheter may be placed in the vein so that the patient can be given a continuous drip for several days. Certain medicines, such as heparin, Coumadin, and bicameral, are given to prevent further clotting. The patient should be kept in bed for 4 to 6 weeks to allow the heart to heal. The length of time resting in bed will depend on the patient's health and the extent of his injury. During the first 2 weeks the patient should rest quietly in heart failure 255. Bed, with the head and shoulders slightly elevated. He should not exert himself in any way. If he must be moved or turned, others must do it for him. If he has difficulty in using the bedpan, a commode can be placed beside the bed and he can be helped onto it. But he must not exert himself in any way for the first 2 weeks. Don't worry about bowel movements for the first 3 or 4 days following a severe attack. Just keep him quiet. Later, regularity should be maintained by using a small quantity of mineral oil, milk of magnesia, or some other mild laxative. He should be given a soft, easily digested diet, as outlined in the appendix. but he should not attempt to feed himself until he is free of pain, and until all danger of relapse has passed. By the middle of the 3rd week he can feed himself in bed. At the end of the 4th week he may sit up in a chair a few minutes several times a day. Thus, by gradually increasing his activity, he will eventually be able to return to his regular work after a period of 3 or 4 months. However, he will have to live at a slower pace and avoid overexertion. He should avoid smoking permanently. Recovery from a heart attack is slow and tedious. But with good nursing care, most heart patients will make a satisfactory recovery. To do so, the patient must develop an entirely new approach to life. Heart failure. Heart failure is a serious condition that develops when the heart is no longer able to carry on its normal work. It occurs in most patients with serious heart disease at some time or other in the course of their disease. The heart has only one function: to pump the bloodstream and keep it circulating through all parts of the body. When the heart is tired or weakened by disease, the bloodstream tends to slow down and fluid will gather in certain areas, particularly the ankles and legs. The lungs may begin to fill up with fluid, making breathing difficult. Causes: heart failure may arise from a number of different conditions, such as high blood pressure, coronary thrombosis, kidney disease, rheumatic fever, diphtheria, and low thyroid activity. Anything obstructing the normal flow of blood, such as mitral or aortic stenosis, will eventually produce severe heart failure. 256 diseases of the heart. This delayed circulation reduces the flow of blood of the kidneys, so that water is no longer excreted in sufficient amounts. This failure to excrete fluid produces edema or swelling of the tissues. The lungs may then begin to fill up with fluid, and this in turn reduces the normal exchange of oxygen and carbon dioxide. This loss of vital capacity in the lungs is very serious and must be relieved without delay if the patient is to survive. As the fluid continues to gather in the lungs, the patient may then suffer from severe spells of coughing and shortness of breath. The skin begins to lose its normal color, turning bluish owing to the condition known as cyanosis. The patient may be forced to sit up at night, or use 4 or 5 pillows when trying to rest. At times he may cough up a frothy, pinkish, blood-tinged material, especially at night. This is pulmonary edema. As the condition gets worse, the patient becomes anxious and fearful for his own future. His liver may be enlarged and tender, and his kidneys congested and unable to eliminate excess fluids from the body. There may be albumin in the urine and also casts. Back pressure on the digestive organs may result in distressing symptoms, such as gas, constipation, lack of appetite, and distension of the bowel. All of this lowers the normal nutrition of the individual and interferes with his recovery. Treatment: to treat heart failure successfully requires both skill and experience, for the patient's body is already overloaded with fluid. In the more severe cases, powerful diuretic medicines, such as mercuhydrin, are injected into the muscles to aid the kidneys in getting rid of the excess fluids. Chlorothiazide tablets, diural, are valuable in maintaining a normal output of fluid from the kidneys. They must be taken once or twice daily to help maintain proper fluid balance. For many years digitalis has been the chief stimulant for the heart. Most patients need 1 tablet a day. Because there is already too much salt in the tissues, the patient must avoid the excessive use of salt. However, patients taking diural or similar water pills may need a little salt. Potassium in some form should be given daily. A glass of orange juice will usually provide enough potassium to meet the body's needs. In the more severe cases, oxygen may be needed, particularly during the night. If the patient is restless, he should be given a mild fainting and dizziness 257 sedative. He should be relieved of anxiety and emotional strain. Many people with mild heart failure can carry on their normal work, provided they have long quiet weekends in which to recover. When the heart is tired from overwork, a few days residential in bed will usually bring the body back to its normal activity. Good nursing care is most essential in more severe cases. The patient should give up smoking permanently. He should be protected from colds and other infections so far as possible, for these place an extra strain on the heart and lungs. After a severe bout of heart failure, the patient should rest as much as possible and only gradually normalize his activities. In the future he should continue a careful program of living, avoiding all unnecessary activity and excitement that might overload the heart. With proper rest, optimism, and well-balanced living, most patients with heart failure can get along fairly well. Fainting spells and dizziness. Fainting or syncope means a temporary loss of consciousness due to lack of oxygenated blood in the brain. The victim suddenly becomes pale and has a feeling of weakness and nausea, then falls to the ground. In most cases, recovery is rapid, often within a minute or two. Fainting spells frequently follow periods of fatigue due to overwork. Standing still for a long time may bring on faintness and dizziness. This may also occur after a person has been in bed a few days or weeks. Just the simple act of getting up will bring on feelings of weakness, because the normal balancing mechanisms of the body have not been functioning during the illness. Any sudden emotional shock may cause fainting, probably because many of the smaller blood vessels are relaxed and there is not enough blood to fill them. This results in a rapid drop in blood pressure. Any pressure in the neck, particularly over the carotid arteries, may reduce the flow of blood to the brain and cause fainting or dizziness. This may even come on after wearing a tight collar. Many nervous people suffer from fainting spells, especially at the sight of blood. Others become dizzy because of breathing too much air. In their anxiety they feel they are not getting enough air, when in reality they are getting far more than they actually need. 258 Diseases of the heart. This condition of hyperventilation syndrome often involves fainting and dizziness. Such people should breathe into a paper bag the moment this strange feeling comes on. Breathing the same air several times in succession will quickly raise the carbon dioxide level in the bloodstream and restore the normal chemical balance of the body. Treatment for fainting: keep the patient lying flat with the head low and the feet slightly elevated until he regains consciousness. This may be all the treatment he needs. However, he should see his doctor to be sure there is nothing more serious. The doctor will want to rule out heart disease, high blood pressure, and other conditions such as diabetes. People who suffer from fainting spells should avoid extra exertion on hot days. A well-balanced breakfast in the morning, followed by regular meals at midday and night, will help to keep the blood sugar at a normal level all through the day. A good program of exercise will help the blood vessels to maintain their normal tone. But all such activities should be done in moderation, especially after some prolonged illness. Dizziness sometimes arises from inflammation of the inner ear, or labyrinthitis. It may also be felt when the knees or other joints are weak, especially after a long period in bed. Alcohol is a common cause of dizziness. Excessive drinking always interferes with the body's normal functions, particularly one's ability to balance. It affects the brain and interferes with normal transmission of nerve impulses. Fever is another cause of dizziness. Motion sickness or seasickness is a type of dizziness due to overstimulation of the body's mechanism for balance. It is common in people who travel, especially if they watch objects passing the car or train. Hardening of the arteries may produce feelings of dizziness. Meniere's disease is particularly common in older people. In most cases it is due to congestion of the tiny semicircular canals, organs of balance, in the inner ear. Even tumors at the base of the brain may cause dizziness. So will wax in the ears in some cases. The wax presses against the eardrum, stimulating the organs of balance. Any lack of oxygen to the vital organs of the body may cause feelings of dizziness. Dizzy spells are very common during the menopause or change of life. The treatment for this is discussed on page 584. Palpitation 259. Irritable heart. Palpitation of the heart is a common problem causing real discomfort in the heart and chest. Palpitation is described as a kind of bumping feeling in the chest. It may arise from a number of different causes, most of which are not related to the heart itself. This is not a true heart attack. Anything that increases the workload of the heart may bring on these feelings of discomfort. Some people experience palpitation when lying on the left side, because the heart is nearer the chest wall in that position. Palpitation is a nuisance, but rarely serious. Many nervous people suffer from palpitation, but this does not mean they have heart disease. A nervous person may be unduly concerned because some friend has recently died of a heart attack. Soon every minor discomfort is viewed with alarm. Such problems do not arise from the heart itself, but from a highly active imagination. It would be well to have an electrocardiogram made though if the palpitation occurs very frequently. If after you have had a complete examination your doctor has found nothing wrong, you have little to fear. But if you have something wrong, the sooner treatment is started, the better. Heart block occurs when the electric waves of the heart are slowed down or interrupted in some portion of their normal pathway. In some cases this may interfere with the regular rhythm or motion of the heart. This interference may be due to some serious condition in early life, such as rheumatic fever or scarlet fever. In later life it is probably due to hardening of the arteries. A correct diagnosis is important before treatment can be effective. Hence an electrocardiogram should always be made. There are several useful medicines that will improve the rhythm of the heart, but these must be prescribed in the right dosage by your own physician. Sinus tachycardia or racing heart is an annoying condition, the cause of which is not always clear. The heart rate may increase because of severe emotional strain, heavy exercise, lack of sufficient oxygen, fever, hemorrhage, and various infections. If the rate is very rapid, over 150 beats per minute, the heart itself may not have time enough to rest between beats. This cuts down the efficiency of 260 diseases of the heart. The heart and slows the circulation of the blood throughout the body. A rapid heartbeat is more serious when there is some inflammation of the heart muscle itself, such as in rheumatic fever or coronary thrombosis. Treatment: some mild sedative, such as phenobarbital, may be all that is needed to control an irritable heart. Some people can slow down the rapid rate by merely pressing over the carotid sinus on one side of the neck just below the angle of the jaw. This may quickly relieve the attack. Others have found that tickling the back of the throat or pressing on the eyeballs may also bring the heart rate back to normal. Although this rapid heartbeat is annoying, it is usually not serious, provided it does not occur too frequently, or carry on too long. If the rapid beating is due to congestive heart failure, it can sometimes be controlled by digitalis. Many people have found relief by eliminating such things as tobacco, alcohol, tea, and coffee. It is always wise to have an electrocardiogram made just to be sure no serious condition exists. Abnormal functioning of heart 261. Fibrillation. Atrial fibrillation is an irregular heartbeat often associated with such conditions as rheumatic heart disease, excessive thyroid activity, and coronary artery disease. When the rate is very rapid and irregular there may be a feeling of palpitation, fainting, weakness, and nausea. When the pulse is very weak and irregular the blood flow to such vital organs as the kidneys, lungs, and brain may be greatly reduced. In other words, an irregular heart is less able to maintain the normal circulation of blood throughout the body. There is also the danger of a blood clot forming in the heart, and a fragment or embolus being carried to the lungs, kidneys, and brain, perhaps producing some serious condition such as a stroke. Treatment: most doctors use digitalis to control an irregular heart. Quinidine is also useful in changing the rhythm back to its normal rate. Although in some cases the heart rhythm may never be restored to its normal regularity, most of these people can get along fairly well provided the heart rate remains around 70 or 80 beats per minute. The patient should try avoid colds and all other types of stress. 262 diseases of the heart. Pericarditis. Pericarditis is an inflammation of the pericardium, the tough, fibrous bag which surrounds the heart and protects it from injury. Pericarditis may sometimes follow a severe throat infection or an attack of rheumatic fever. It is frequently seen in advanced tuberculosis. If there is bleeding or hemorrhage into the pericardial sac, this may interfere with the normal motion of the heart. Chronic constrictive pericarditis means that the pericardium has become attached to the surface of the heart itself. This may result in congestive failure, discussed on page 260. Pericarditis is often associated with coronary thrombosis, when the injury to the heart muscle has extended to the surface of the heart. In such cases, anticoagulant drugs or blood-thinning medicines must not be used, or there may be severe hemorrhage into the pericardium. In certain chronic conditions, such as advanced tuberculosis, the pericardial sac may become distended with fluid. This is known as pericardial effusion and usually follows some serious infection. It may also occur in myxedema, low thyroid activity. Treatment: in most cases the swelling of effusion in the pericardium will more or less disappear as the underlying disease comes under control. If not, it may be necessary to pass a long needle into the pericardial sac and withdraw